Is this supposed to project, or it's not a projecting one?
It's for LCD.
Nice, nice work. This is so they can hear me on TV. So I'll speak really loud. If you're ready to get going, good morning, everyone. Thank you for joining us. Hello. Cindy Wade. I am the president here for MaineHealth Lincoln Hospital and our community, including our senior living facilities, including St. Andrews Village. And I am very honored to be in that role. For those of you that don't know me, this is my community. I've grown up here in Lincoln County, and I absolutely love being a part of this organization. And we're excited to have you all here. We have a few things on the agenda that I'll go over in a second. I did want to tell you my birth date, not so that you can get me birthday presents, but if you'd like to, that's perfectly fine. So 2965. Why am I telling you my birth date? February. So hopefully when you come to visit us, now if you come to your primary care physician, if you're seeing a specialist, if you're in the urgent care, the emergency department, wherever you come to visit us, I'm hoping that you're being asked your name and your date of birth to identify who you are. So it's super important. I think it gets a little annoying for people when you get checked in by the PSR, the person at the front desk, and they ask you your name and date of birth. Then the medical assistant comes and gets you, and they ask you your name and date of birth. And then the provider comes in, and they ask you your name and date of birth. But there's a reason behind that. And the reason behind that is we want to make sure we have the right person for the right care. So we want to make sure that you're the right person receiving the care we're giving you. It's not unheard of that mistakes get made and a patient gets called and goes in to get an MRI or goes to get a CAT scan or goes in to see a provider, and maybe it's Jane Smith, but it's not Jane Smith with the right birthday. Or maybe they think they heard their name, they get up and they walk with the technician, they get in there, they have their MRI, and lo and behold, I thought I was here to get my lab work done. I sound silly, right? It sounds silly.
It happened just 2 days ago. I was waiting, and the woman came out and called for Jane. 2 women stood up, and it was actually the wrong woman who was insisting she was the right one, and when she checked further, turned out it was the other one. So
it happens, and it's our responsibility to drive you a little crazy asking you that name and date of birth, and hopefully you participate. If somebody doesn't, you might want to say, don't you want to know my full name and date of birth? Because we're all part of our care, right? And I would hope you'd want to make sure you're getting what you're supposed to be getting and not getting an MRI when you're supposed to be getting lab work done. Unfortunately, these mistakes happen across our country on a daily basis. So we are very adamant, and you will quite frequently hear me on our daily huddle or in meetings, Cindy Wade, 2965, because I'm trying to promote the fact that we want everybody doing that. Right patient, right care. Right person, right care. Super important. So today on our agenda, we have some great things. We have Jennifer Girardin, who's our Director of Patient Safety and Quality, and she's going to talk a little bit about a Patient and Family Advisory Council. Really a great council, and we're looking to recruit a few people for that council. We also have Donna Stevens behind me. She's got some toys in here with her, but she's going to talk about what's going on using these great mannequins in the nursing program, which is near and dear to our hearts. The nursing program is 15 years old. I think it was 78 nurses have graduated through the Central Maine Community College partnership with MaineHealth Lincoln Hospital that we provide in Damascotta, and we have nurses that we still have in our employment. Between us and Penn Bay, more than 75% of those nurses remain within the MaineHealth system. And we celebrated that 15-year partnership this past week. I think a few folks were there. Patty and Sally were there, yeah. Marva was there and others were there. And it was a fabulous celebration of a great idea that came to fruition 15 years ago and will continue into the future. And at the week before that, Central Maine Community College recognized MaineHealth Lincoln Hospital for their partnership and awarded us at their annual event for award ceremony the 2025 Community Partner of the Year. So that nursing school has been instrumental in helping us to train nurses and then hire nurses and retain nurses in our community. It's been fantastic. So we'll get some time with Donna. Then I'm back. I'm going to talk a little bit about post-acute care, which is the new terminology around senior living care. And so I'll talk about that. I'll give you an update because I know that that is something that people are very interested in. And if you have other questions, I'm happy if we've got time to answer questions. And even after time, I can hang around. I also want to do an infomercial. These are on the table. These are magnets for your refrigerator if you so would choose to have one. Check wait times and reserve your place in line. This is for the walk-in care clinic. So urgent care, you come and it's first come, first serve here in Booth Bay. If you can't get in there or you need to get in and get seen and you happen to be in the Damascotta area, it's the walk-in clinic. And you can actually check through the QR code or going online. It's kind of cool to find out when you can get seen. So that's just for you in case you would like to have one of those. They're on the back table along with some other things. And I think that's all I have to start. So thanks again for being with us. I'm going to hand off to Jen. Jen's fantastic. Jennifer has been with us. Gosh, has it been a year yet, Jennifer? Nope. Not quite, but it seems like she's been here forever with us. She's fabulous. We're really appreciative to have her. She is very focused on our quality and safety in every area of our organization, and she's going to talk to you about this great council that we're trying to revive.
Good morning. Jen Gerardin, 21071. Just make sure I know who I am and you know who I am. I am the Director of Quality for the Lincoln Hospital community, so that includes everybody. I do have a little bit of influence or insight into the quality that happens here in our long-term care facilities, but your staff works really hard to make sure your quality of care is amazing. So I let them do their work, right? So I wanted to talk to you a little bit about our Patient and Family Advisory Council. We're trying to relaunch. So this was a team that was put together. They started it, I think, back in 2019. They stood this up. It is a group of community members that come and talk with the staff and the providers and our nurses to see how we can improve the quality of care from a patient perspective, right? So what are the duties that you want to talk about? So when you come onto this council, your job is pretty much to give us the patient perspective. It's hard for us to see ourselves through a patient's eyes because we know the backstory, right? So it's hard for us to remove that backstory and really look at how something looks to everybody who comes into our facilities. So we want to make sure that we are welcoming and comfortable and we give all the information that everybody needs to have a productive and pleasant experience through our facilities. To that end, the benefits of having this is just that, is making the patient's experience that much better. We want you to point out the good and the bad, right? Because that's what we want to know. We want to do our best job, but we can't do that if we don't know what we're not doing well. That's the responsibility of this committee. So what does it entail for time? We do have a meeting every other month. That it takes about an hour. It's about an hour meeting. Outside of that, we do have you go off into the community occasionally for events, or we did have at one point people coming to talk to patients while they were in-house to see how their visit was going, if there were things we could do, we could do better. What else do we need?
Next slide.
Yeah, that'd be great. One more slide, please. There we go. So again, it's just asking you to attend different events for our patients to make sure we're presenting ourselves in the best way possible. We have a lot of construction that's going on in our facilities right now. So one of the things that I was hoping to get this membership back up and going is to try to do walkthroughs through those, once we get those that construction done, to make sure that the flow works well, that it's accessible for people that might have a little bit more of a difficulty moving around. So it's items like that. I went to visit at Stevens Memorial. They have a very robust team, or we call it a PFAC, so Patient Family Advisory Council, we call it a PFAC. They have a very robust one, and one of the big things that they did last year was they looked at gowns. So their chapter leader, she's a petite woman, and she kept tripping over those gowns. You know, they're ginormous, right? You go in the hospital, she kept tripping over those gowns. Well, she was bound to determine that that was not going to happen at Stevens Hospital. They worked really hard. They did a lot of research. They were able to find a smaller gown that was affordable for the hospital to purchase. They ran it through leadership, and they were able to get smaller gowns for those people so they don't trip over those gowns, right? Because that could lead to a bad injury. We don't want that. We want you to come into the hospital and get better and then send you home, right? So those are the kinds of things that we do, that the PFAC does. We did have a little bit of trouble after COVID getting this back together. So now that everything is stable, we're hoping really to bring this back to the community, and I need a couple more people to come in and volunteer to be on this committee. I'll take anybody from any of our areas that we're looking, communities that we service, because again, we're one big family, and our facilities are in both communities. So I'm looking for community members to come in and take part in that. I have applications online. I can send you them via email. You can go to the next slide. I think that's that's me. So if you were interested, or if you have more questions, feel free to contact me anytime. Give me a call. If you call the front desk and just ask for the quality department, they'll send you right to me. That might be a little bit easier to remember. Yeah.
You can also reach out to the philanthropy department, either myself, Brevin, Julie, Sarah, or I'm going to even volunteer Cindy. So if you want to reach out to any of us, we will get you in touch with Jennifer.
I'm happy to answer any questions, chat with you some more. I can come back and chat over here if that's easier for folks to meet this on this side. But I'm just looking to get people involved. That's all. Any questions for me? Great. Thank you.
Sign up.
Thank you very much for your time this morning.
Awesome. Thank you. Thanks, Jennifer. So, as I said earlier, we have Donna here with her toys from the nursing school. And again, I talked a bit about how exciting that nursing school has been over the last 15 years. I would say thank you to our donors. The auxiliary is a big donor for the nursing school, and the auxiliary gives nursing scholarships every year, all throughout the year, actually. It's an amazing group of folks that support the nursing school program and are local people that want to become nurses, which is fantastic. And again, this is how we're growing our own. It was a vision. It was probably 18 or 19 years ago we started talking about a nursing school program, and we had a visionary, Alan Davis, who was on our board of trustees for many years, and it was his vision that we should figure out how to provide a nursing school locally. And through his work and the work of Kathy Cole and others at the time, we were able to work with Central Maine Community College to provide this program. There's a classroom over in the Education Center set up there for didactics, so they can do their classes online with instructors and professors at Central Maine Community College, and then they get to learn from some of the best nurses around. And so I'm going to turn over to Donna. I don't want to steal her her excitement and thunder here, but very proud of having this connection, this partnership, and the ability to train our own nurses here locally. So, Donna.
Thank you. Okay.
Sorry, guys.
I can help you with that if you need to. Yep, slideshow from the beginning.
Thank you. Sorry about that.
No worries. So, good afternoon, everyone. I'm grateful to be here today to share what we do for the nursing program and also what we do for Lincoln Hospital for the nurses that are in their first year out of nursing school, where they still need more support, education, and collaboration. So we continue that through that first year. So my name is Donna Stevens. I'm Regional Clinical Educator. I'm hired by Lincoln Health Hospital, but I also work for MaineHealth, and I'm regional, so I go up the coast. I go to Penn Bay Medical Center, and I also go to Waldo. And this is my partner over here, Mike Grant. Mike Grant is a net learning specialist, so he takes care of the learning management system. He's also the SIM specialist for me. So I couldn't do my job without Mike because he handles all the technology. So Donna Stevens, 52463. We didn't have computers when I went to nursing school 40 years ago. Yeah, no computers when I went to nursing school 40 years ago. So without Mike, I wouldn't be able to do my job because he maintains the mannequins, he runs all the technology and sets it up. I do the clinical component of it. So that's what I'm going to show you today about what we do. So here we are, the Coastal Simulation Team. So we work with the Hannaford Center for Simulation and Innovation out of MaineHealth. They have a medical school program down there as well as a huge simulation center. And we have brought that technology and the mannequins to the Mid-Coast area to serve our community in conjunction to help with them. And Mike and I were recognized in 2024 for Simulation Teaching Award by the MaineHealth Institute for Education. So that was, we were pretty excited about that. So there Mike and I are with our birth mannequin, Victoria. We couldn't bring her to demonstrate today. She's pretty big, but those of you that were there last Monday, we had her up and running. So next slide, please. So here is neonatal simulation with baby Tori. This is one of our big projects that we work with. So this is baby Tori. Baby Tori is a high-fidelity mannequin that we can do neonatal resuscitation or baby codes on. When babies are first born, sometimes they don't cooperate and they don't want to breathe, and they need a little assistance and help. So this mannequin, we can simulate everything that we would do with a newborn baby. So the baby can have cyanosis, meaning blue. It needs oxygen. The chest, it can have chest rise where the baby is breathing. They can listen to heart sounds. They can listen to lung sounds. They can put breathing tubes in the baby if they need to. This is a simulated umbilical cord where if they need to put a line in there to give the baby necessary IV fluids and medications, we can do that. The baby seizes and moves, it cries. So she's pretty special. And we've been using her for the last 3 or 4 years. And we run in conjunction, if you notice here, we have a TV cameras here looking down, and then we also have a screen. And what happens is Maine Medical Center has their neonatologist down in Portland, and Mike puts cameras up in the ceiling so they can observe the team. And we always have a pediatrician, 2 nurses, and a respiratory therapist. And we run drills every month with the supervision of the neonatologist so that they can debrief the team afterwards. So, and I'll show you some of the data, or I think it might be on the next slide. What we've shown over the last couple of years is an increase in this is how the team has done in the maintenance program. So this was the first from 22 to 2023, and then 23 to 2024. We went from doing monthly sessions to doing quarterly sessions to maintain their proficiency. Because in our area, we don't have NICUs, but we need to resuscitate sometimes and take care of sick babies. So this indicates that they get this practice time that they wouldn't normally get. So that's worked out really well, and we're happy to have this baby to be able to do that with. So the next slide. So this is an example of the warmers. So we go what's called in situ. We go into the hospital. We use their equipment. We use used equipment that they have, all of the supplies and everything. and I go in. My history, I did 22 years in obstetrics before coming into education. So I set the whole scene up, and then we run the drill. Okay, next screen. This is our mom mannequin. Her name is Victoria. She is a high fidelity mannequin, and she does everything. She breathes, she tracks, her eyes open and closed. You can check her pupils. She talks. She has heart sounds and lung sounds. She gives birth. We can run lots of crisis with her. We can run postpartum hemorrhages, shoulder dystocias, and we've done other emergency drills in the hospital. I do just regular deliveries for our nursing school program in our sim lab over at 66 Chapman Street here in Damariscotta, because they don't have a high birth rate at the hospital, and so the nurses need more practice. So Mike and I offer that for the nursing school. Next slide. This is what it's like to put a baby inside the mom's belly so that it can go through the birth canal and actually give birth. It's a great simulation. And this is her set up in a pen bay, actually in a bed, set up ready for delivery for the team. Next slide. So I set up a delivery table, again using used equipment that they've had before so they're familiar with it, so the teams can practice in the hospital setting. Next slide. We simulate medications. We put blue in the IV fluid so it doesn't get confused or left behind, so that it's really important that we think of safety factors when we're bringing equipment into the hospital so it's not left behind and patients don't get injured. We also simulate other medications in their emergency cart so that they can practice everything right in the hospital in their normal setting. We use monitors. These are their monitors up here that they use to monitor mothers and babies when they're having a delivery. And we have iPads that Mike has programmed to simulate the same that they have, and we put them right where they would be looking so that they know. Next slide. So this is a pretty exciting thing. We've only done this once with Victoria. So this was practicing a mother going into cardiac arrest and needing an emergency C-section in the delivery room. So this is not in the OR. This is in the, and so this would happen if someone came in a car accident, or usually our mothers are young and healthy, and this is a very rare occurrence. But when it happens, it's an emergency situation, and we have to act very quickly. So we simulated that situation, and we have the surgeon cutting an incision. She's opened the abdomen. We have nurses doing CPR and respiratory, providing breath for the mother. Can we do the next slide? Delivering the baby through the abdomen and cutting the cord. Next slide. And then when we're done, we debrief the team. We go over what went well. What did we do really well with? What could we improved on? What supplies did we need? What equipment? What team members did we need? Do team members need education so that we can improve what we do? So this is a debriefing afterwards that we do with the teams. This is how much we need to take when we take Victoria on the road. So I want to thank the St. Andrew's Auxiliary, because they donated money to get us an ambulance stretcher to be able to move Victoria. I'm really, really grateful for that. So thank you for your generosity. But you can see we have Victoria on a table, so we'll have a stretcher, so we won't need to have the table, so thank you. And then all of our equipment that this is coming out of the education center to put in the car. Next slide. This is what it's like to put it in the van. So this is Mike's van, and we clear out the seats and everything to put the equipment in. Victoria is wrapped up here, and then this is all the equipment we need to move her. And that's just another view once we get everything in the van. Next slide. This is in my small SUV. Sometimes we put here's Victoria, her legs come off, and we put the legs in a box here. So she's covered, she looks like she's in a shroud here. And then we fill out the back. But when we really need to take all of the equipment, we need a bigger vehicle, and we take the van. So this is another demonstration that what we have is what we're doing to try to educate our community. So Cindy mentioned about you going to your primary care office. When you see your medical assistant, they need, like nurses, they need annual competencies and training. And usually it's boring PowerPoint, and we have them come in and demonstrate some skills. But we had someone from the education department she had a degree in, she's a nurse, but had a degree prior in art. And she created the Zombie Apocalypse Skills Fair. And you can see she created a movie, MaineHealth Educates. These are all the medical assistants. We had a fog machine with the sound, and it was scary. She put zombies over the windows here. So it made it very interactive. They had to figure out that there was an outbreak of a rare disease, and they had to give vaccines to the community. So it was kind of, because that's what they do. They give you your vaccines. Next slide.
I will say that the fog machine set off the fire alarm. She wasn't going to admit that.
That's my bad. The fog machine was just to say one puff of smoke, and when we were busy running around, it went on to automatic, and it kept producing more smoke. It's non-toxic smoke, but it did set off the fire alarm. We didn't even know that. We were watching the movie, and I could hear this noise, and I'm like, what is going on in the hallway? So I went outside, and I heard the fire alarm. I'm like, oh no. So I came back in, and I said, we have to evacuate. And my partner was like, what do you mean? We're showing the movie. I said, no, the fire department is going to show up. The fire alarm went off. Sure enough, I go out, and if you go to, so anyways, this is how we use our mannequins also. So I went outside and I forgot that I had makeup on, and I'm telling all the people that evacuated the building that I was sorry, that our fog machine, so we got in trouble, so we couldn't use the fog machine anymore. Anyways, she set up an escape room. This is one of our mannequins that they can actually auscultate and listen to a blood pressure on the mannequin. And this was to practice safe patient handling of how to get somebody that has a hard time moving and get them up onto the exam table. And then this is, they call it an escape room. My partner's very creative. So they had quizzes and puzzles that had lock boxes on it to figure out what the next clue was to be able to get out. And the next slide. Again, that's just the mannequin that we used. This mannequin can be male or female, has kind of masculine features, but we put lipstick and glasses and a wig on it to make it look more feminine, and then put a blood pressure cuff on it. And then this is an IV arm that can be used for practicing phlebotomy. So when the medical assistant is drawing your blood, we have them practice. And this is an injection arm that we put on the shoulder and making sure they give the injection in the right place. It has lights that light up that tell you, yes, you're right, you're deep enough, or you're not too deep, or that you're not in the right spot. So we make sure everyone is competent. And so, so this is me with, I had more makeup on, and I walked around the corner, and I think Julie was out there, maybe Revan, I don't know. There were a lot of people in the parking lot, and I ran out, and I'm saying, I'm so sorry, it's no fire, it's just the fog machine, and I forgot that I had. So we dressed up for the zombie apocalypse. This is the woman that, Sue Laverty, I want to give her credit for that. I want to show you another mannequin that we have, because he was easy to transport. His name is Hal. His pediatric Hal, and he's 5 years old. And Hal can do a lot of things. He's one of our coolest mannequins. Mike put him in the front seat to transport him, and he stopped in to get gas, and a police officer came up to him, Waldebaro, and said, how old is that child, and why is he restrained in the front seat and not the back seat? Mike had to tell him it was a mannequin. So this is Hal.
That was a fun explanation.
So as you can see, Hal will blink, Hal will track. So if he's looking at me, if I go over there, he's going to look and follow me over there. He breathes. You can listen to his heart sounds. We can do CPR on him. We can do a lot of things. He has a lot of facial expressions. Can we have a couple of facial expressions? So what is that? Angry?
Pain. This one's angry.
Angry.
Surprised.
Surprised.
Scared.
Scared.
Tired.
Can make him the next.
That's all the good ones. Most of them are only a little bit different. Which one?
Right?
Oh, yeah.
I can't do this without Mike. I just tell him what to do and he makes it happen. Oh, so if you see, he's got tears coming out his face and he's crying. I want my mom! I want my mom! Oh, Hal, I'm so sorry. You'll be okay. We're going to take really good care of you. So he's good to do pediatric advanced life support or any other pediatric, and thank goodness we don't have a lot of children. We have a pretty healthy community, but when they do come in, usually to the emergency department, right, that's where we need them. So HAL is a really good tool to use as well. I last want to just share, I don't know if you can get the spreadsheet up.
Let me try.
So some data on what we've done with simulation over the last few years. So starting in 2016, there was just one ED trauma simulation. In 2017, another one, pediatric HAL, was in the emergency department. 2018, we did some more simulation, the Education Sim Center, doing stroke and a heart attack. You see, and then we increased in 2019, we were doing more. We have Victoria on board now, as well as SimMan. 2020, we had a little bit because we were going through COVID, but we still continued to be able to do some of the simulations. Same in 2021, that was really when we were shut down, if you all remember. In 2022, we really picked up. Mike came on board, and Mike, he started 3 years ago, and so we paired together. Before, it was the nurse running the software and doing the simulation, but it's a lot more realistic, and we can do a lot more with two of us. And you see we have Tori, we have SimMan, we have Victoria, so we're using various simulators based on what we needed to do. And then in 2024, we had a lot more, you can see, and this is going across the region. We increased our uses of our thing running MOOSE simulations. MOOSE stands for Maine Ongoing Outreach Simulation Education. That's in conjunction with the Hannaford Center. So we did a lot more. In 2025, we're still going strong. We're trying to get as much education out there for our community for whoever needs it, with our nurses, the CNAs, our RNs, our doctors, respiratory therapists, so that they can all do a great job taking care of you. So that's all I have. Any questions? Thank you for listening.
So pretty spectacular. As you can well imagine, this equipment's not cheap. So again, shout out to our many donors, but to the auxiliary, who's very, very much supportive of what we do over in education and for the nursing center. And thanks, Mike. Sorry, I left you off on the initial introductions. I apologize. But it is a great dynamic duo here, and then you add Suzanne, who's extremely creative and a little scary with the apocalypse. But it's fantastic, right? So a couple of things that it does for us. I already mentioned the nursing school, and it gives nursing students the ability to do things that we don't do a lot of. You know, we talk about pediatric patients. We see pediatric patients, a lot of pediatric patients in our family medicine and our primary care, and along with pediatric physicians. But we don't do a lot of inpatient pediatrics because, again, the population's pretty healthy. We try to keep our kids healthy. And when we do, it's usually during respiratory season when they're getting bronchiolitis or RSV or some kind of thing that they need to be in just overnight. If they need more intense care, we send them to the Barbara Bush Center. So it is good for people to get their hands on something as lifelike as this mannequin. Who cries and says, "I want my mom." So it's pretty spectacular, right? Because it can, when you do education, everybody goes, "Oh, I got to get on the computer, do my education." But this is not at all like that. This is really getting your hands on and learning and touching and starting IVs, you know, drawing blood, doing all the things, which is pretty fantastic. And the team's super creative. People love working with them, and we can train, like Donna said, CNAs, MAs. The docs use the simulations. The docs can do advanced cardiac life support, so they run through if somebody was to have a cardiac arrest, and among other things that they also utilize the simulation mannequins for. So it's pretty amazing. Sure.
So the philanthropy office is right next to the huge classroom that they use. And when they did that zombie apocalypse, I can't even say it, we were out of our minds that day. We couldn't get any work done. They were having so much fun in there. They were laughing, and we were all just like, when is this class going to end?
As soon as the fire alarm goes off, that's when.
That was a bad thing.
That was fine.
Making education fun helps them to remember, helps them to retain, and makes it engaging.
It does, and they want to go to education when it's fun, right? And it's important that we continuously educate our team. So it's pretty cool. Makes me want to go play with the mannequins with Donna and Mike. So thank you. And so fabulous would be, I think, a few of you that were there. I think they said as soon as they said we're going to deliver a baby in here, they walked out. Not everybody wanted to see a baby being born, but those that stayed in the room to watch were blown away by what that mannequin does. So it's pretty cool. All right. So I'm going to talk a little bit about post-acute care, which is really senior living services. I don't know, in healthcare like the military, actually the military is pretty consistent with their acronyms and their changes of names. But in healthcare, we have to change the names every so often because we got to keep us on our toes, right? So post-acute care. But before I get to that, I want to talk a little bit about what's going on around us. So we've been talking a lot in the system across the country, in the state of Maine, very much locally, about what are some of the things happening. Because there's a lot of fear right now in healthcare. There's a lot of concern. I think you all know we've have an aging population, so a lot of people are retiring. There's more people to care for. We don't have as many people to care for people. And so that's been coming for a while. We don't get reimbursed well, whether it's Medicare or it's MaineCare or it's third-party payers. There's always controversy about how we're going to get reimbursed, how we're going to get paid. Those have been things going on. But what we've seen over the last couple years, and certainly in the last year and 6 months, is a lot more concern, a lot more heightened concern. And this just is a slide to show, and it's already outdated because things are continuing to evolve, whether it's state discussions or it's federal discussions, and there's lots of impacts. But just to talk about, there are, and this one shows regulatory external forces, service reductions that are happening across the state, financial stress, and emerging trends. So this is just a shot on one day of looking at what are we thinking about today, and again, it's outdated because this evolves quickly, but of things we have to be worried about, things we have to be thinking about, things we have to be planning for. And I talked about some of this over here with the regulatory MaineCare funding issues, with the state at odds on whether or not we should continue to have as many MaineCare people and how we're paying for those, with the budget issues that we've been navigating in the state. But if we go up to service reductions, we've had several OB closures in the last year in the state of Maine, and the last couple of years in the state of Maine. And just recently, Waldo, which is part of the MaineHealth system, Waldo Hospital in Belfast, closed their OB unit and transferred all the labor and delivery to Penn Bay. They continue to see mothers prenatally, so before they have their baby, and postnatally after they've had their baby. But the actual delivery is now happening at Penn Bay or wherever they choose to go. So that's something that's happening. Every day we hear something new about Central Maine Hospital and what's going on there. Northern Light, so Eastern Maine, changes happening there. They're having to decrease workforce. They're closing some services across their footprint. Maine General announced last month they were going to lay off 100 people. They've navigated some of that. They've actually decreased their children's health services in the last few weeks. So that's not even on here. St. Joe's has closed, and then there's a lot of long-term care facilities closing. We've heard a lot about that. Over the last 10 years, we've pretty much cut the number of nursing homes in half in the state. Financial stress, you can see over there, York Hospital is struggling. They've reached out to MaineHealth for some help and support and help them navigate. Central Maine Medical Center was sold to Prime, which was, they have a nonprofit arm, but they are a for-profit company that's come into the state and bought Central Maine Medical Center. Big hospitals, even in, so Northern Light, but Beth Israel, Maine General, Mass General, are all struggling. They are struggling to meet their bottom lines, so they're having to do cuts, they're having to change their services, significant challenges across the country, across the Northeast, in the state of Maine, happening. And then emerging trends, there's more private equity entrance into the state, so some folks coming in to, like Prime, to buy hospitals. There's others coming in, taking over certain service lines and creating service lines like vascular services. We have more Medicare than we've had, and we have a lot of Medicare Advantage, which is part of a different part of Medicare that doesn't pay as well even as Medicare. A potential recession, we don't know. We're looking at what would that mean. And just getting back to the state of Maine issues with provider payments, those provider payment holds by the state of Maine is $100 million just for MaineHealth that we won't receive until at least July, if we receive it in July, if it doesn't get extended and doesn't change more. $100 million in reimbursement just for Maine Care because they've held provider payments. Significant external forces that we are facing. I don't say this for doom and gloom. I say this because I want people to understand the pressure that people are under. Our team is under a lot of pressure in that they worry about all these things, right? They worry about how are we going to be impacted? How are we going to be impacted in Booth Bay? How are we going to be impacted in Waldoboro and Wiscasset? How are we going to be impacted more in the state? And so there's a lot of concern around that, and a lot of focus and a lot of work. We are committed to health care. The MaineHealth system is committed to access to care, patient experience, high quality, safe care. But we need to financially figure out how we're going to be stable and not have a boat that's sinking, is one of the analogies. You know, there's some big ships out there sinking and things closing because they can't weather the storm of what we're facing right now. MaineHealth is staying on top of the water for now, but it's not for a lot of planning, a lot of preemptive work that's happening, and a lot of work happening every single day in all of our entities across the MaineHealth system. So I just want you to be aware that that's happening. I think people probably have their own sense of what's impacting them right now in the world, but this is what's impacting our caregivers. I'll say last week was Care Team Appreciation, and many of us were out and about. We had food trucks, we had goodie bags, we had lots of stuff going on. I say all the time, Care Team Appreciation is not 1 week out of the year. Care Team Appreciation is every single day, because we have amazing staff all around, and lots of folks here that are working every day so that we have high quality care, access, good experience, and we want to keep them engaged. We want to keep them working with us. We want to keep them so that they're happy and they're not concerned, and that they know that we're working to make sure that every aspect of our healthcare system stays intact. Sorry, a little doom and gloom, but good news is that we're on it, we're working on it, and we're engaging our team to make sure they know what we're doing to make sure we stay afloat. So getting back to post-acute care, the system currently has gone through an exercise of looking at all of our senior living services that we provide that are MaineHealth entities. And you can see here on this map where we have, and you can see St. Andrews, you can see Lincoln Health on the Damascotta campuses, Quarry Hill and Sussman House, which is a hospice house, up in north by Penn Bay. Midcoast has their groupings of senior living services. New Hampshire has one called the Merriman House, so that's in North Conway. That's part of the MaineHealth system. And that's what we have currently. It has St. Joe's down here crossed off because MaineHealth made the decision many years ago, just like we had talked about here, should we build a new facility and consolidate services? Well, in the Portland area, they had made the decision. St. Joe's was a pretty old facility with a lot of major renovations that were needed. And so they did partner, and there was a new facility built by, oh shoot, I'm gonna draw a blank, Mike Tyler's group. and they partnered with North Country Associates, and they are providing the service. So St. Joe's is crossed out because we no longer as a system own St. Joe's, but we partner with North Country Associates and Sandy River Company, there it came back to me, Sandy River Company to build this new facility. It was a great idea because of the hundreds of thousands and millions, actually, of dollars that it would have taken to get St. Joe's back up to where it needed to be. It's a brand-new facility. However, its access to care is a strain because, as we know, there is an aging population with a lot of needs, and there's certain things that you can't provide. We can't even provide here at Zimmerly and Gregory Wing. We don't do dialysis patients here because we can't provide access to dialysis for somebody. We don't, behavioral health patients that are in long-term care, nursing home or need skilled care are difficult to place in a small unit such as Zimmerly or Gregory because you have to manage all the behavioral health needs of that person, along with all the people that you have to keep safe, because you don't know how that person's going to interact or react. And I'm not talking somebody with depression, I'm talking somebody with significant long-term mental health. So it's not easy to take all people that need senior living care into small facilities. So we're looking at how are we going to do that as a system. For instance, oh, did you already go on?
Sorry.
No, that's okay. I just want to make sure.
Trigger finger.
Woo! And then part of post-acute care is our home health and hospice. That's another part of an analysis that will happen. But the system decided that we needed a partner, and so they partnered with Optum, which is a big consulting firm that came in, and they're working with Maine Medical Center on throughput through Maine Medical Center. Even though it's huge and we have lots of beds at Maine Med, we still have bottlenecks there. And so they're working with the whole Maine Medical Center and Southern region on how to navigate and how we should be focusing on getting patients that need the care at Maine Medical Center in and out of Maine Medical Center to free up beds for people that are still waiting to get into Maine Medical Center for whatever it is they need at a tertiary care center. So we've been working with Optum to look at, and they have an expert arm on senior living. There are people, Jennifer Skaggs, who is the lead that we've worked with, and Cheryl Wistabarth has talked to him, and Kelly's talked to him, and I've talked to him, is an expert. She's been doing senior living for over 35 years, and so she knows across the country what's happening. She's very into it, but she still listens to what's happening locally with our teams. And so they came in and did a big analysis with a lot of assessment that took place, and you can go to the next one. And not only working with our MaineHealth post-acute care and senior living folks, but also with others that are in our catchment area that are independent or owned by like Sandy River Company or North Country Associates. They worked with them as well because they wanted to understand what's going on in their worlds. Not very different than what's going on in our worlds. All the same concerns and issues and challenges. But they went through all of these different things. They looked at how are they structured from a leadership, what services are provided, what are the resources, what are the lack of resources, what are the outcomes, do we get good quality of care, are we seeing safe care in these places? So lots of analysis and assessment, and again, that's why they came and talked to Cheryl and Kelly and others in all of those areas that we own, plus the ones that we don't own, to get a good look at what's going on. So go ahead and go to the next. And they found some themes, not a surprise, and nothing I don't think that we've pretty much haven't talked about here over the years of talking about senior living and maintaining, sustaining senior living options here in Lincoln County. So shouldn't be high acuity patients. I just talked about some of those. Dialysis, substance abuse disorder, I didn't talk about. Bariatric patients. It's hard to have large patients that require all special equipment when you have a very small staff. We looked at behavioral health, which I just talked about. They found that there's 78 facilities left in Maine, and since 2010, more than 20% of facilities have closed, just since 2010. Staffing shortages, not a surprise. Travelers, the cost of salaries, the cost of contract labor. And they looked at reimbursement, which is pretty poor for senior living facilities across the country, but especially in the state of Maine. So they looked at a whole bunch of things, and these are the things that they found were most important. Now, no surprise, right, that, and I think we've talked about this here, and I know that the team here at St. Andrews Village and I have talked about it for many years, is that MaineHealth is phenomenal, but senior living was not its thing for many years, and we have lots of senior living. So we've been doing our thing, working with our own internal experts, the Cheryls and the Kellys and the Cheryls up in Damerscott and the Loriman Looks in Quarry Hill, Kathy Bean, who was at Knox Center before it closed. And we worked as a team, and we worked really closely as a region to try to make sure we were doing things alike. What are you doing that you're in quality? How are you managing this kind of thing? And so we've done a lot of that, but not a real system focus, except for during COVID. There was a heightened awareness because there were so many things that we needed for our long-term care facilities during COVID. But really just a focus on what do we really need to make sure that we sustain and maintain these services for our communities in the state of Maine. So what do we need to do? And one of the things that they found is that we need system leadership that's overseeing not just our local leadership. So I'm going to think if we go to the next, I might be ahead of myself. Oh, so they established there were 6 work groups. We had input to all these work groups. I was on the steering committee of this work, and these are the sort of things. They looked at governance and leadership. Who do we partner with? What's our staffing looking like? How do we leverage telehealth in our senior living facilities? How do we look at our transitions from hospitals to post-acute care? How's that working? And then pharmacy is a big component of it, right? We outsource pharmacy in our senior living facilities. Perhaps we need to look at insourcing. We have huge pharmacy resources in the system. So a lot of things were looked at, a lot of work groups dug in to different aspects. And the number one recommendation that came out of this is that, okay, there's a lot to do in senior living. There's a lot to make sure we're sustaining and maintaining that high quality care, access to care, experience is positive for the people that live in our facilities and come to our facilities. So the decision was made that we would hire what's called the post-acute care chief operating officer. Not a surprise, I was on a group 2 years ago, and this is what we said would be a great idea. We needed somebody at the system level that this is what they do for the system, is focus on making sure we're maintaining and sustaining this level of service for all of our entities. And so we're in the process of interviewing somebody for that position. There will be 3 lead positions, a senior medical director, a senior nursing director, an operations leader. I don't know how, once a new COO is hired, somebody will be interviewing, they'll be interviewing in part of that process. But that group of people will oversee directly all of our entities across the MaineHealth footprint. Merriman House in North Conway is not on here, because before COVID, Merriman House was working like we were with Sandy River Company to transition that care, and they were going to build a new facility, and that stopped during COVID. They have reinvigorated that post-COVID, and they are going to partner with that company that they've been working with, and they're going to build a new facility. So they're going to be divesting of it in New Hampshire of that. But for us here, we'll have a structure, and Cheryl and I were just talking about it this morning, how nice it will be to have a group that is focused from the very high levels of the system all the way down to the boots on the ground, and that we'll be working together to make sure that we're sustaining our care for our seniors in our communities and providing access to levels of care that are necessary as people age. So here's sort of a timeline, not perfect for sure. We're in the process of interviewing for the COO position. That COO will then work towards getting their team set up and to get those folks working with all of our individuals through all of our entities, and not just our own MaineHealth, but part of that work is going to be partnering with others in the state to make sure we don't lose any more senior living services in the state of Maine. We don't have enough today. We don't want to lose any more. How do we take lead on making sure that we don't lose any more in our state and work with our partners? So that's a big focus for us. I think that's it. Lots of stuff. And you've had me here before, and I've talked about all the things we've been trying to do to make sure that we have these services for the people that need these services. And that was the appendix. It's a lot of detail. I don't think we need it. Thanks. Yeah. Just a lot of words. This is really important. As you know, it's been extremely important to me over the years. It's important to the team here, the Barbaras and the Cheryls and everybody that works here. And it's important to the system. They're creating a structure to make sure we can sustain and maintain these services and work with our partners throughout the state to make sure we're doing that as well. And advocate, have strong presence at the state level with our legislators to make sure they're paying attention to this huge issue that we're facing with dwindling numbers of facilities and growing needs for those facilities and that level of care. Questions, concerns, thoughts? As my kids used to say to me in kindergarten, Mom, only questions and positive comments, but I'll take all. Yes?
I think your job must be horrendous.
I work with amazing people, so that's why I love my job.
Pretty well. I take it that you're going to do a lot of organizational changes with setting up groups to take care of varying things. Is the administration and paying administration a major problem?
Paying.
Where does benefit come internally or government or?
So do you mean like the structure of leadership in the system? So it's a great question, and it's one that gets asked quite frequently, right? So we have some amazing new leaders in our system. You know, Andy Muller has been here just over 4 years. Kelly Elkins, I think, so Andy Muller is our Chief Executive Officer for the system, and Kelly Elkins is our Chief Operating Officer. He's been here just over 4 years. She's been here I think just 4 years now. Brought in a whole different view of healthcare and what we needed to do to be sustainable into the future. All healthcare, access to care, patient experience, patient quality and safety, engagement of our care team, very important. And then always finance, like how are we going to pay for this? So building a structure that's going to move us into the future. Some of the future's a little bit shaky. We're not 100% sure where it's going to go, but I think that's been a little true for many years. And creating what will be able to sustain the services we know are important to our communities. So that's sort of the background. I would say the new structure of how we're trying to do this is important, and we're going to transition some of the older kind of structure we've had to be able to meet the growing needs of our regions. So that's why we became regional, so we could work together more closely as regions to provide access to care for our communities from Brunswick to Belfast, for instance, in the coastal region. And yes, some of that costs money, but we look for other ways. AI is becoming a hot thing. How do we leverage AI in a positive, safe way to help support us so we can be as efficient and cost-effective as possible? So do we get reimbursed for administration? No, we don't get reimbursed for administration. We get reimbursed for the care we provide to the community. So what we have to do is build an infrastructure that can withstand how we get reimbursed, but also be efficient enough and progressive and innovative enough that we can move into the future. So there's a balance, and the constant focus that we have on every single day. Are we being as efficient as we can? Are we staffing the right way? Are we not wasting linens? Are we not throwing clean linens in and getting them rewashed because we just were throwing it in the bag? Are we making sure we're getting our supplies at the best cost? Are we, all the things that going into making sure we're efficient and effective, we are always looking at that. Because if the more efficient and effective we are in what we do, the balance is there to be able to provide an infrastructure and leadership that's going to help us maintain what we need to do in our communities and move us into the future. So I don't know if that answered your question, but there's a balance, and it's a constant focus on how many senior leaders do we have? How many do we need? How many directors do we have? How many do we need? And so there's a balance, because you don't want to have too many leaders. You want to make sure you have enough staff, but you got to have leaders to navigate all those things that are coming at us as well. So it's a balance.
Has MaineHealth made all this easier or more complicated?
I would say easier. So so change is hard, and it's constant change. But we would not be able to do what we're doing today without MaineHealth. We saw that. It was like this huge blinking light through COVID. If we didn't believe in MaineHealth before COVID, boy, during COVID, we needed to believe in MaineHealth. That without MaineHealth, there would not be all these services available. We would not have withstood that as an independent entity. No way we could have done that. And that's where you saw some changes across the country where people could not. And that's why we're still trying to get out of that. And with everything else coming at us, even though we're coming out of COVID, got all these new things coming at us, that's why you're seeing closures across the country and in the state. So yes, it's a positive for us. Some days it's the change is like a fire hose, it feels like, but people are trying their best to figure out how we continue to provide, and I'm sorry if I feel like a broken record, but access to care as close to home as possible, and leveraging each other, for instance, in the region to be able to do that. And we would not be as strong as we are today if it weren't for the MaineHealth system and the work that we do together. And I would be remiss if I didn't say our vision is working together so our communities are the healthiest in America. I think everybody believes that that is where we have to head all the time, and all the work we do every day is to get to that vision. Yes, sir.
Is there a Maine Hospital Association, and if so, how do you interact with that?
Yes, there is. We interact all the time with the Maine Hospital Association. Stephen Michaud is the CEO, and he is very connected to the entire state. We participate in many things with the Maine Hospital Association. They are a strong advocate. I sit, for instance, on their public policy, so their governance affairs. So when the legislature is in session, we are constantly at the table understanding what the bills are, what's going to impact us as a system, us locally, and we're advocating and we're supporting the work of those folks. We have the same governance affairs group, Katie Fulham Harris and Sarah Calder, who are fabulous, and they work together. And I sit on that governance committee group too, so we're hearing what's MaineHealth looking at and thinking about, how are we navigating that and dovetailing that with the Maine Hospital Association, and Katie sits with both. So we are constantly working together as one for the good of the state for healthcare. Great question. Yes, ma'am.
I couldn't help but notice when I saw the state of Maine map, everything concentrated in the southern areas. Is there a corresponding group in northern Maine doing similar groupings and care that you brought for us?
Yes. So Northern Light is a system like MaineHealth, who is in the northern part of our state, and they work with smaller hospitals just like us in order to maintain care and access to care and high quality care in the northern part of our state. They are facing all the same things we are. They are constantly at the table trying to figure out and navigate how the impacts of all the things that we talked about and more. And we work with them, like we are partners. We don't compete. We want to work together because it's super important that they maintain their footprint with healthcare and long-term care and senior care and pharmacies and all the things they do in the northern part, because God forbid more of those close, and where are all those people going to go for care? And there's just not the capacity in the southern part of the state to do the entire state. So we need big partners. We need partners in this healthcare journey. We partner with Maine General all the time to work together, because again, that's a big footprint in that middle part of the state. You know, and we're hopeful that Central Maine Medical Center will be able to navigate with this new partner Prime and be able to reestablish itself to help partner, because we need all of those facilities to take care of the state of Maine. Anybody else? We're probably close to time. Oh, we're over time. I apologize. If there are things you would like to hear from us during these community meetings, we are here for you. Sometimes we're trying to figure out what we should be telling you about, talk about, but really, if there's something you're interested in, I had a feeling senior living services might be one. But if there's things, and this was certainly exciting, and Jen in her infomercial trying to recruit a few more people to our Patient Family Advisory Council, which is pretty cool. When it's up and running, it does some great stuff. They've done some really good wayfinding and brochures for patients from the patient's perspective. Super helpful. But we want to bring information to you that you are interested in or wondering about. So please let us know if there's something you'd like to talk about.
So I'll just let everyone know that July 25th, we will be having our next community meeting. It will be up in Damascotta. You're all welcome. We will also have it live streamed on LCTV. You can either watch it live or you could watch it on their YouTube channel anytime you like. The other exciting thing, we're working on a 5-part series, a speaker series. We did one last year and it was really successful, and we have some phenomenal speakers this year. One of them is Katie Fulham-Harris, she is our
Government Affairs
person. She's going to come in and talk to all of us about the work she's doing right now, which is absolutely fascinating. So I hope you'll join us. It's going to be held up at the Scadompa Library. The speaker series, we will be getting information out to all of you. And again, LCTV is partnering with us. So if you're not able to join us live, you will be able to watch it.
And a big thank you to LCTV, right? So it's great that you all can be here in person, but there's lots of people that can't. So they can either watch this live streaming from their home, or they can go back, like Revan said, and take a look at what we talked about. So it's a really great partnership we have, and we really enjoy that partnership, and we leverage each other on a daily basis, I think, pretty much. So it's good stuff. All right, thank you for coming.
Thank you.